So we have another patient asking, do myeloma patients require multiple prior therapies prior to being eligible for CAR T? And what's the rationale for not implementing CAR T immediately, which probably has to do with FDA approval based on clinical
Yeah.
trials at this point?
So any drug, let alone CAR T, any drug can only be given in the situation that it is approved by the FDA. So basically, in accordance with that drug's FDA approval label. Currently, CAR T cell therapy is approved in the US after at least 4 prior lines of therapy, and the patient must have had treatment with at least one proteasome inhibitor, for which we have 3 drugs, bortezomib, ixazomib, and carfilzomib. They must have been treated with at least one prior immunomodulatory drug, lenalidomide, thalidomide, pomalidomide, and they must have been previously treated by at least one monoclonal antibody, daratumumab or isatuximab. Once the patient has had all these criteria met, they become a candidate for CAR T cell therapy. Frankly, we cannot just use a drug anywhere because we cannot use a drug where it has not shown to be of benefit, and importantly, it has not shown to be of any risk. So CAR T cell therapy in the first line setting is being studied in clinical trials, but is not FDA approved. Currently approved only after 4 prior lines, but the FDA is reviewing data for both the CAR Ts to see if they may be available sooner. As of right now, that approval is still pending.
Okay, thank you. We're hopeful that that will happen soon.
Hopeful.
Yeah. So interesting question from a patient. Does CAR T therapy actually change one's DNA?
No, the CAR T therapy does not change one's DNA. What happens is there are T cells taken out of a patient. The DNA of those T cells is modified, and then those T cells are given back to the patient. Those T cells do not go and integrate into your other healthy body cells or your stem cells, etc. Those T cells, it's almost like giving a boost of immunity, which is targeted against your myeloma. So those T cells go in and they kill those myeloma cells. Now, we hope that those T cells perpetuate and teach or create some memory T cells, and that immunity lasts a little bit longer. But all of that genetic modification stays within the T cells. It does not integrate anywhere else. Now, I know there was a previous question about T cell lymphomas. That is related to this question in a way because the risk that is theoretical is that that genetic modification in the T cells might make those T cells replicate uncontrollably, leading to a T cell cancer or T cell lymphoma. But I'm saying that this is theoretical because while it is possible, it happens extremely rarely. And even in the cases where the cancer happened, it has been seen that the cancer may not come from that portion of the DNA that's where the modification was done. So low risk.